Hello, my name is Razmig Zovigian from City of Hope. We're going to show today how to do the extremity solution board that you can utilize for every position for lower extremity or upper extremity. And it's done many ways. You can use it in infinite ways. There's no limitation on how to use it. But today what we're going to show is that we're treating like the foot area by elevating the non-affected foot and leaving the affected foot straight down on the table, and how to mask it, and also how to use it for low dose radiation treatment like for arthritis. So that way we can also show those positionings, and it's also the same way it's used for upper and lower. There's no limitation. That's good. So the first one that we're using is basically we're treating, let's say for IMRT or photon treatments.
Perfect.
We're elevating the non-affected foot above and leaving the affected foot down, and we'll mask the foot over here, and also we'll mask the foot this one so it's immobilized, and it will be the same position day to day for the treatment. So if you want to give me the mask. And this mask also, if you even, let's say it doesn't work, you can put it back in the oven or the water and it goes back to its original shape, and then you can reuse it on the same patient. So the key behind it is to just basically get it close to the bottom of the foot. And then after you put it on, stretch it. And just lock it down.
I got it.
And usually just you can push it down here and make it more like this, so that way you can create the bottom of the foot as a stopper. So that way day to day when the patient comes in, it's not moving down or it's not moving up, falling in the same position. And this one also, we have the knee mask where you put a mask on here. You can use that too also to mask it over here for using keeping this foot the same place. For IMRT, no, it's fine. It's doable. So the key behind it for this foot is always to make it attach the foot, touches the foot perfectly. That way you can be reproducible the same way. And it's very important for keeping the foot in the same position day to day. And we use this one a lot for IMRTs or any sarcoma patient that we're going to treat upper area. We can mask the foot and support the knee, so that way we'll be reproducible on and on for the treatment.
So, Raz, sometimes when we show this for sarcomas and such, we often demo it with a treated foot up here. So why are you doing it this way?
Well, the reason I'm doing it that way, because when you elevate this foot, you have a clear path coming from the lateral view all the way from posterior to this side. And when you do an IMRT, you can stop the radiation when you get to the other leg and just continue again. So you get almost full dose all around without radiating the other leg. Or if you want to do like a lateral foot, it's perfect. You can do lateral treatment from left and right by opposed laterals. So that's the reason we elevate this foot away. But sometimes you get a situation that the tumor is more anterior than posterior. You can bring this leg down and still angle in an anterior way and just get the dose the way it's supposed to be. So that's why it's like multiple ways you can approach this, not one certain way. It's very infinite ways to use this device. There's no limitation. So now we're going to try another one where we use on a low dose radiation arthritis treatment. Let's say the patient comes in with a toe that has a toe arthritis. They want to treat the toe or the foot, upper anterior foot, the distal foot. So now we're going to position in a way that this way, when you're doing the gantry, it doesn't come on an angle like this. You just have to adjust the foot according to get the gantry cleared. So the key behind this one, usually we can make a vac back and elevate the foot like this. And usually on an arthritis patient, they can't put their foot straight down flat. So they always have a discomfort for being all the way down. So what we do, there's two ways you can do. You can create a custom cushion under the foot area like this, where you can build it up and put the mask on top. I can get the foot mask or the other one too. I can do both.
Yeah, I'm going to do the other one because it's the foot one's stuck together.
So for this one, we can use the regular knee mask or the foot mask, whichever you want to use, whatever you have. Doesn't need to be exactly foot mask only. And it's very simple as it goes. You can stretch it a little bit and then put it on top like this. And then now you can build where the toe stops here, and then you can use this one, and the patient will be able this position for treating the toe area for arthritis. And you can even use the foot mask if you want. You can build it under it. You can lock it at the bottom and slide the foot in there and create like a socks. It goes in there and takes the shape of it, and you can use it that way too. So there's multiple ways you can use this mask. It's not limited. This one, at this point, because it's an arthritis, you can keep this leg down. It doesn't need to be elevated for arthritis. But right now she's comfortable like this. We're leaving it that way. So that's why. So that's the foot. The other one that we're going to use right now is for the hands, which is very popular for arthritis right now. We use for hands. And the hands you can do two ways. You can do, if the patient able to do Superman position, lay down, put the hand all the way out here, or when the patient not able to do, they can lay down and put the arms up over here, and you can mask on this one. You don't have to mask it all the way in the back. You can mask it on this one, and it's easier for the patient's shoulder. Or if the patient's skinny enough, you can put this one right by the body over there where the hand's gonna be, and position a little bit laterally, but you have to be careful. You can't do too much lateral, then the table won't clear. So you have to be careful with that. So you put laterally, and you can put the hand on the side to do it. But from my experience, a lot of patients like to be on a Superman position, and you don't have to worry about the dose to the hip, if it's gonna hit or not, protecting other body. So be careful your head. So basically, you can do this way, or if you feel like too far, there's no space right now, I'm gonna just bring it down this one a little bit more. Just unlock it.
Yep.
So just rest your elbow like this. And we can make the custom cushion again on the rest, and then you can make the mask right here in this position. So you can use build a custom cushion again. As you can see, the shoulder is not like flat. If an older patient, they usually tend to we put a pillow and they rest on the pillow with their headrest and this arm right there, and you can make a mask on top. And you can still lock it over here, and you can use it for the treatment. As easy as it gets.
Do you want me to get the mask?
We can try it, yeah. When you have a custom cushion, what I do, I build it over here where it's softer, there's no edge table, and it's easier for the patient. And let's say if the doctor says, hey, I want a bolus. When you're making the custom cushion, you can put the bolus in there and then make the mask. So then on the anterior portion, when you put the bolus on, it's already there. The posterior one, to match it, it's gonna be harder. So you can just build around it. I have a patient, sometimes there's a patient, they do electron treatments. I use this one sometimes for electron, where the patient having hard time to position like this. I do this way. Let's say if there's a tumor in the palm, then we can do electron straight down with no problems. I'm telling you, this device is like you can use for many ways. There's no limitation. It's infinite ways of doing it. And it's reproducible, easy process, quick to treat the patient with no difficulties.